So today we're going to be preparing an IV infusion. We received an order from the provider for our patient Joe Schmo. He ordered normal saline, 1,000 milliliters of that continuous for 8 hours. So we calculated out our milliliters per hour to be 125 milliliters per hour, and our drop rate is 21 drops per minute. So we'll take that order information and verify it against our medication MAR. So that would be our 6 rights of medication, right dose, right patient, right time, right route, right documentation, and right medication. So in preparing our solution, we will pull this from the MAR using our 6 rights of, pull this from the Pyxis, verifying our 6 rights of medication with the MAR, and we can see that this is 0.9 sodium chloride injection, 1,000 milliliters. The expiration on it is March of 18. In reality, we would have a saline bag that is not out of date. If it was shown as expired, we would go ahead and toss this and find one that had the correct date. So we will go ahead and open that up. The trash can. Move that over a little. Okay. And we can examine for particulates, changes in the bag, changes in the color of the solution. We want it to be clear. We want to see no cracks in the bag, no discoloration, nothing odd like that. Okay. So on this, now we're going to start preparing this. So we're going to perform hand hygiene. Now we will label our bag with the patient's name and the start date, then the discard date, the time of infusion, which would start at 1:30, 13:30, and the ending of the infusion, which would be at 21:30 or 9:30, giving us an 8-hour infusion. Also has the RN's initials on the bottom. So we'll go ahead and maybe label our bag. Here we go. We're going to want to label that on the back side as to not interfere with anything. We'll also go ahead and label our time strip, and this just shows the date and the hour of the infusion starts. So 4/4/18, the infusion starts at 1:30, 13:30. It shows our infusion rate and our drip rate, which is 125 milliliters per hour and 21 drops per minute. So okay. Now we can apply gloves for this next part. So we've already performed some hand hygiene. We're going to go ahead and grab our primary tubing, making sure it is primary tubing. This has a drop rate of 10 drops per minute, which is what our calculated rate was based on. Check the tubing for expiration date, and it's not expired, so we'll go ahead and open it. There it is. And then we'll kind of examine our tubing as well for any cracking, discoloration. As you can see, this one is kind of discolored, or maybe that's just the color of the tubing, but in this case, because I do kind of view it as discolored, I would grab another one and either compare it to make sure that that's the actual color of the tubing, and if it wasn't, I would grab another one that was not discolored to ensure patient safety. So we'll go ahead and open this guy up. I'm going to close our roller clamp to prevent a mess, and then I usually like to pinch this one too, just in case. Go ahead and locate our spike here. And we're going to maintain sterility at all times. Pop that off. Oh, pop that off. We're going to go ahead and screw that in there, making sure that spike is in there nice and firmly. And we'll go ahead and hang this up. We're going to prime our tubing. So to do this, we're going to need to unclamp, and we're going to need to unclamp the roller as well. And squeeze and get some fluid to fill our drip chamber. You usually want it, there's a little line in here. If there's no line, you usually want to go for just about halfway. And then we will very slowly prime the tubing here. What we're doing is just preventing any air from going into the patient's bloodstream and causing an air embolism, which would not be good. can see there's fluid dripping out of there. We will go ahead and close the roller clamp, and as a double safety, clamp that. Hang this up here and make sure to maintain sterility on that. We'll leave that cap on, that'll help remain sterile. And then we will gather the rest of our supplies, flush a catheter, an IV site tegaderm, some alcohol swabs, tourniquet, and saline lock. And we'll go ahead and transfer all this to the room, including the IV pole. That'll ensure that no patient information is left out and that we have no other mistakes. One other thing we would also do, just to be double sure, is to label the tubing. I prepared a label ahead of time that has the patient's name, date of birth, and the time at which the tubing was placed on the IV thing. Some medications require different tubings and they have to be changed every so often. So you just want to go ahead and label that. And then we will transport everything to the patient's room. So I would first start off by introducing myself to the patient, because we're going to go ahead and perform this IV infusion and access a peripheral IV catheter. I would enter the patient's room, perform hand hygiene, ensure patient privacy, check patient safety measures and staff safety measures, raising the bed if I needed it. I usually don't. I would ask the patient what their name and date of birth is. He is Joe Schmo. Date of birth is 3/22 of 78. Once he verified his birthday, I would go ahead and verify with him kind of the ins and outs of an IV infusion, ask him if he's ever had one. Born in 78, so chances are he's probably had one before. Even if he says he's had one, I would go through a rundown. We're going to just tell him we're going to go ahead and insert a very small needle into one of his veins. And then this plastic catheter will go up into the vein, and we'll secure that and run fluids through it, as the provider has ordered 1,000 milliliters of fluid. So after we get all that out of the way, we will verify our fluid order with the MAR. We would verify our fluid order with the MAR, make sure that that is all good using our 6 rights of medication: right patient, right dose, right med, right time, right route, and right documentation. So now we would kind of get stuff set up here. I would start by kind of assessing for an IV site, put on the tourniquet. Our Joe here has alopecia, so we're not going to need to shave him or anything. Be about 4 to 6 inches above the injection site. Pop that tourniquet on. Make sure it's nice and tight, but also establish a radial pulse. Make sure it's not too tight. And I come up here and start palpating for a vein. You want to find a vein that's got some nice, good bounce back. Make sure you're not going into a tendons. Tendons will feel very hard. Veins are nice and bouncy. So we've established that there's a great IV site there. His skin integrity around that area is phenomenal. So we'll loosen our tourniquet, because we don't want him to sit there tied up. It's not very comfortable. And we'll get our supplies ready. So having already performed hand hygiene, we can go ahead. We'll prime our saline lock. Just being very careful. We really want to maintain sterility at all points during this. This one was in there backwards. That happens sometimes. So what I'll do is take this off. I'm still maintaining sterility here, so. Oh, these, I have a hard time getting them off. So we'll go ahead and attach this. Ah, I caught it. Kind of pull back a little, break that seal, and we'll come over to our trash can. That's good and primed, so we can set that right in there. We're still maintaining the sterility of that, not compromising that in any way. Okay. Now, we can go ahead and pull this out. This is our tegaderm that we're going to be using to cover the patient's IV site. And this has a nice spot in here to write the date, the patient's initials, and the nurse's initials. So the date today is 4/4/18. Patient's initials are JS, and the nurse's initials are mine. And then the time, I would also put the time of the insertion was at 13:28. Now, we've got that all pretty ready to go. I'm going to go ahead and put my gloves on. We'll tie up our patient again here. Okay. Now, we're going to double check. We've already verified expiration dates on everything else, so we'll just double check ours on our IV catheter. This one does say 8/2017, and so in reality I would get another IV catheter. For now, this will do. So go ahead and alcohol his vein here. We'll start moving in a circle from the in to the out as well. If you're using a chlorhexidine swab, you're going to want to make sure you go in a cross-like pattern. And while that's drying, we'll get our alcohol it twice. We're going to go ahead and use a second alcohol swab. Get it real good and clean. Usually when I do this, I'll scrub. I'm used to having patients that tend to have dirtier arms. I'll scrub with one alcohol swab, and then I'll do the circular motion with the other alcohol swab. So now that that is getting good and dry, we'll go ahead and leave that in there. We can open our gauze first, because that alcohol's still drying a little bit. Always making sure to talk to the patient. Some people get really, really nervous when it comes to IV insertions, and so maintaining a nice conversation with them will help them feel a little less nervous. So we're going to pull our IV catheter out, and we're going to maybe pop that off of there. Okay, and we want to loosen the hub a little bit because sometimes those little guys can get stuck. Okay, now our patient is ready here. We'll pull that off. We're going to locate, make sure the hub is loose. There we go. Okay, we're going to locate the bevel on this, make sure that the bevel is pointing up. We'll stabilize the vein, just like so. Tell the patient to take a nice deep breath in and relax as much as they can. Just be a quick poke. And once we get in there, we'll see flash. Once we see flash, we stop advancing the needle and advance the catheter. Pull that back until you hear a click. Advance the catheter all the way. Now, here comes the fun part. We're going to find where the tip of the catheter is and go just above it and pinch the vein while we're moving the hub. And with one hand, I'm going to pop off. There we go. Pop that off. We already primed, but it looks like we got some air in there, so we'll go ahead and push all the air out. And we're going to go ahead and attach this on. There we are. And we can pop the tourniquet now too. So now we'll withdraw to make sure that we're actually getting blood into the the IV push, the saline IV push, so we can make sure we're actually injecting into a vein and not into soft tissue, which would cause infiltration. We're going to slowly inject about 5 milliliters of this solution. Do it real slow, and we're also going to keep monitoring our IV site for any signs of infiltration while we're doing this. Okay. Once we hit about 5 milliliters, we can undo our saline lock. We'll take our piece of gauze. First, let's clean up, just in case we got a little bit of blood on him. I didn't this time. And we'll just kind of clean up around the IV site, being real sure to not get this near that open site because it will sting and your patient might be a little cranky. We'll go ahead and we're going to fold this and tuck this right under here, kind of prevents that skin breakdown there. And using our tape, we can also shimmy this under here as well, and being very sure to not occlude the entrance of the catheter and just stabilizing that. We want to be able, we can always see that catheter site. That is very important. And then I'll place another piece of tape as well, just right around there. Okay. Then we have our previously labeled Tegaderm with the date and the patient's initials and my initials and the time that I put it on. So we'll just go right over like so with that. making sure all that's visual. We can still see that catheter tip in there, so we know how our site's looking. Get rid of all of our kind of excess trash. Your patient's pretty stable right now. They're hanging out, you're chatting with them, making sure that they're not getting dizzy or anything for having a from having a IV placed. Then we're going to go over here. So we've already verified this with the MAR when we walked in the room. We verified that our infusion was for this patient and it was the correct dosage. I'm seeing some error again in the lines, and so I would just flush the line again, just cause it doesn't hurt. There it goes. There we go. Got a couple big bubbles I wanted to get out of there. So now we're going to go ahead, you can set this here. And I would alcohol our site right here. Make sure that that's good and clean. If it's already saline locked, we've just done the flush. We can go ahead and unhook that. Okay, so we're going to go ahead and throw that out. And then we're going to come over to our sterilized hub here, and we'll stabilize and insert that in, twisting it on nice and tight. Making sure we're checking in with Joe, seeing how Joe's doing. How you doing, Joe?
I'm good.
Oh, good. All right. Unclamp that.
What are you doing?
Well, I'm going to go ahead and set this drop rate for you, and that'll help get this fluid into your arm.
All right.
Yeah. It'll make you feel a little better, too.
Sounds good.
All right. So I'll set the drop rate here. Turn the watch around so I can see what I'm doing. Okay. Okay, so we're at 21 drops per minute. So now that this is set, I'm going to go ahead, Joe, and I'm going to tape this to your arm so that it doesn't get caught on anything.
All right.
That way if you decide to wiggle around on me or feel like turning over in bed, you know, won't get stuck anywhere. That'd
Thanks for doing that.
No problem.
I like to move a lot in my sleep.
Oh, a lot of people do. I'm also a wiggler. I totally understand. Okay. So now that that's taped really good. Okay, we'll check on Joe. Joe, do you need anything else while I'm in here?
Nope.
Okay, sounds good. Well, I'll lower your bed down here so you're comfortable. Make sure your side rails are up so you don't tumble out when you're wiggling around on me. Perform some hand hygiene, and if you don't mind, I'm just going to kind of sit here. I'm going to document what we just did, okay?
Do I need to look for anything?
Well, yeah, you might want to look for any what we call adverse effects or any side effects. So if you see any redness or if you have any pain or if it looks like white, you know, like kind of when you get frostbite and it looks white, if it looks anything like that or if it hurts or feels real cold to the touch, you just give us a call. Remember what that call light looks like?
Yep, that red one with the plus sign thing.
You push that and I will come running with bells on.
Okay.
Any other questions?
Nope, I think I'm just going to watch some TV.
Sounds good.
All right.
All right, I'll just hang out in here and document. You feel free to turn that TV up.
Perfect.
So I'll go ahead and document that we inserted an IV in the left peripheral, kind of like, I would put something that would say like about 2 inches below in the AC area. We'll document that we started the IV infusion. We'll document what we started it with, the time, and how he tolerated the procedure. Also, what type of needle we did the procedure with. We used a 20 gauge IV catheter, so we'll do that. And we document all that, what time, how he did, and then we will leave Joe to his television watching. Okay, knock knock. Hi Joe, how you doing?
I'm good. How are you?
Oh, I'm doing good. Hey, I just came in here to check your IV. Can you verify your name and birthday for me?
Joe Schmo, 3/22/78.
Okay, I performed some hand hygiene there. So I'm just going to check and make sure that everything's still running smoothly here with this infusion, okay?
All right.
All right, so I'll go over and gather my data. I'll check the MAR and see that it is a 1,000 milliliter continuous solution of normal saline. We're going to infuse that over 8 hours. It started at 1:30. We're in here 2:30, checking it after an hour. We see that it's infused at 125 milliliters per hour. We would probably double check the math too if we were feeling real fancy today. And we can see that the drop rate was set at 21 drops per minute, which we can also double check. And the nurse who started this was kind enough to write that on the bag for us. So we'll look on the back of the bag and verify that the patient's name and birthday, initials and birthday, the start date and time, and the discard date and time. So that would be 4/4 at 1:30, and 4/4 at 9:30 would be when we were stopping it. The nurse's initials who started it, as well as the time that she started it at. And we'll check on our time strip here and see that it's been down about 125 milliliters in the last hour, so that means that that flow rate is going well. And then we'll kind of just move our way down here. We're going to look at the tubing and make sure that the tubing's not discolored, cracked, any air bubbles in there. We don't want to see any air bubbles. We can get an air embolus, which can stop a heart pretty easily. Kind of looking down, making sure everything looks great there. And then we'll assess his IV site as well. We're going to look at where the catheter inserts the skin here, so we've got a nice visual on that. Look for any redness, signs of phlebitis, signs of infiltration. If it's infiltrated, it'll be kind of pale, raised, cool to the touch. And then any evidence of bleeding. We don't see any of those. His IV site looks fantastic. So we're going to ask Joe. Joe, have you been having any pain in that site at all today?
Nope.
No pain. And you haven't noticed any redness or swelling or any weird feeling in general in that area, have you?
No, nothing like that.
Oh, good. All right, well, if you don't mind, I'm just going to make sure, I'm going to check this here drop rate. The rate this little drop is going down here, it's got to go a certain number of times a minute. So I'm just going to double check it and make sure it's running right, all right?
Sounds good. I'll just keep watching my show.
Sounds good. Okay, so we got 7 drops in 20 seconds, which is going to equate out to 21 drops per minute, which is our drop rate. So that's good. Going to check in with Joe, and we're going to talk about we're going to do a little patient teaching. I'm a big fan of patient teaching, Joe. So
All
just
right.
bear with me.
Sounds
So,
good.
what I want you to do for me is you got to be kind of on the prowl for this kind of weird side effects going on, okay?
Okay.
All right, so what I want you to watch for is redness,
Okay.
swelling,
Okay.
any irritated looking, kind of like if it starts to look a little bit red, you know when you get a scratch and you itch it and your skin turns red?
Mm-hmm.
Kind of look for that.
All right.
And then you're going to want to look and see if it gets what we call infiltrated. And it's a kind of a weird word, but basically what we're looking for is if it turns white and it gets cold to the touch.
All
What
right.
that means is that saline's not going in your vein. So we want it in your vein, right?
Sounds good.
Okay.
And I do that with that button,
Yep, you can... Which button are you talking about?
that red button.
Oh, that call
That's what
light.
I do.
Yeah, that's how you get in touch with me. So if you see any of that, I want you to push that big red button and give me a jingle, okay? I'll come running, and I'll
Okay.
come check it out for you.
All right.
Okay? All right, I know you've been here a while, and you're maybe thinking you want to take a shower soon, don't you?
Yeah.
Yeah, would you mind waiting on that a little bit? I'd like to keep this infusing here until it's done about 9:30 tonight. And if you're jonesing at 9:30, I'm sure we could get somebody to give you a shower. Otherwise, we could wait maybe till the morning.
All right. Sounds good.
Because I can't have this site getting wet.
Okay.
And so if you do want to take a shower, what we'll do is we'll take this tubing off when it's all empty, and we'll do something called saline locking. So we're going to put another piece of tubing on there that'll keep just a little of that saline in there. Keep that IV site ready if we need it. And then I'll put a big plastic bag on your arm so you can take a nice hot shower. Do you have any questions for me, Joe?
No, I don't. I'll just watch my show.
You just watch your show. I'll be back in about an hour to check in on you again. I got to check this every hour, okay?
All right, sounds good.
Okay. So then I'll go ahead and lower the patient back to normal level if I moved him at all. Make sure his side rails are up, patient safety, patient privacy, perform hand hygiene. And I'm going to document as well that I was in to check it, that the drop rate was consistent, that the flow rate was correct, that the IV bag and tubing, that everything, there's no particulates, no cracking, no color changing, no air in the line, that the IV site had great integrity, no infiltration, no redness, no swelling, no bleeding, no phlebitis signs, and then we will document all that in the computer, and we'll be back to see Joe in an hour.